So one of the other most popular procedures that we do in our office is a MACS facelift. And what a MACS facelift is, it's basically a short scar or mini facelift. Another name for it is a modified S-lift or lifestyle lift, quick lift. All of these names are very similar for the same type of procedure. My own personal philosophy is if you can tell somebody's had a facelift, then that's a sign of a bad facelift. So we really strive, and I think we're very successful at creating a very natural, soft look so that people who've had a facelift done by us cannot tell, other people cannot tell that they've had a facelift. Now there's three components to the facelift. First, we start off by doing liposuction on the neck, and that is necessary to remove any excess fat or fullness in the neck and along the jawline, including the jowls. Once we've finished liposuction, the next part of the facelift involves the actual lift. And this is performed through an incision that's made just in front of the ear, curls around the earlobe, and then in the back of the ear. So it's about a quarter the size as a traditional facelift incision. Through that incision, we lift up the skin over the cheek and then down onto the neck. And that gives me access to a deeper layer. That deeper layer is called the SMAS. And what the SMAS is, it's a fascial layer. And what a fascial layer is, it's a very tough layer. And that's the layer that we pull on because you don't want to pull on skin. Skin's more like taffy. And if you pull on it, it'll stretch and it will look stretched. So to avoid, again, any type of operated look and to give you a soft, natural look, we pull on that deeper layer. And once we've pulled on that deeper layer is also connected to the muscles in the neck and the jowls. So when we pull on it, it pulls the neck skin up and the jowls up. And we usually shorten it by almost an inch. And then once we've pulled that up and fixed it, then we trim the skin around the ear. And so that's the second part. The third part of the procedure is actually volume replacement. And the way we do that is with fat injections. As we age, we lose fat in our face. And I think that ages us more, actually, than any wrinkles or drooping to the skin. And we typically lose it around the eyes, on the cheeks, in the folds just between the mouth and the nose, and in the marionette lines. And so to replace that, what we do is we harvest fat from your stomach or your hip area. We centrifuge the fat and separate out the live fat cells. So it's actually like a live graft. And we re-inject these fat cells into those areas, which again just softens the look, gives it a more natural look, and it's a permanent solution to the volume loss that most of us experience as we age. The incisions, once we're done, are closed with dissolving sutures, except for two, and these are one on each side of the face, just above the ear. I typically don't put drains in, and I don't put dressings on. We used to wrap people up like a Q-tip. We don't do that anymore. A little Neosporin on the incisions, and we send you home. I like to see you back the next day after surgery to make sure there's no problems, usually a week after that, to get those sutures out, and then 2 or 3 weeks after that. Most people look very presentable after 2 weeks, and some as early as a week. Typically there's minimal bruising with this procedure and very little discomfort. We will give you pain medications if you need it, but again, most people I think are very comfortable after the procedure. Results last 8 to 10 years, but even 8 to 10 years down the road, you look better than if you never had it done. I recommend ages between 45 to 55 are the best time to have it done. We do patients up into their 80s, but when you're in your mid-40s to mid-50s, that's when your skin has its best elasticity and you'll have the longest lasting result. And again, I think our facelifts look extremely natural. People who've had these done look refreshed. Patients come back to me saying that people notice something's different, but they can't quite figure it out, think that they've lost weight, rested, or just refreshed.